Hey everyone, in this lesson we're going to talk about avoidant personality disorder. So we're going to talk about what this condition is. We're also going to talk about some of the risk factors for getting this condition. We're also going to talk about some of the symptoms, how we can diagnose it, and how we can treat it. So avoidant personality disorder is a chronic personality disorder involving a variety of difficulties in social situations. And really what a chronic personality disorder is it is a pattern of behavior that is persistent, pervasive, immutable, and dysfunctional. So what do all of those words mean? So persistent and pervasive mean that this pattern of behavior is chronic. Immutable means that it is difficult to change or it's unchangeable. And these behaviors are dysfunctional, which means that they don't operate well in social situations. It is actually a cluster C personality disorder. And among other things, it involves awkwardness in social interactions. But individuals with this condition have a desire to be relatable to others. So there's many other components of this condition we're going to talk about later. What is the epidemiology? So it's actually estimated to affect 1.5 to 2.5% of the general population. And we find that females are affected slightly more often than males. So what is the pathophysiology of avoidant personality disorder? It's actually a combination of psychological elements. So there's several beliefs that these individuals might have. One of them is that they may feel that they are inferior in some way. Another is that they have a fear of rejection, and they have a generalized behavior of avoidance of social situations, and they have an inhibited emotional expression. So all of these, especially the first two, feeling inferior and a fear of rejection, lead to the third and fourth point. So because they have a belief that they are inferior to others in their social environment, and they have a fear of rejection, they have a generalized behavior of avoidance of social situations, and they have inhibited emotional expression. And really, this may all relate back to things in the past, and we're going to talk about these in the next slide. But these individuals may have a history of multiple past disappointing relationships where the patient blames themselves. And all of this combined may result in extreme introversive behavior. So they may become introverted and not develop emotional bonds or relationships. So what are some of the causal factors? One of them is genetics. So the heritability coefficient is actually estimated to be around 0.6. So we can look at a family history. Is there a family history of avoidant personality disorder or certain similar traits in one's family? We can also look at how the patient was as a child. What was their temperament? This can be a causal factor. So kids that were hypersensitive or had rigidity or a rigid outlook on life, or had a high harm avoidance, are more likely to have avoidant personality disorder. And early experiences during childhood, I mentioned past experiences may lead to or increase the risk of this condition. So what type of early experiences during childhood? Well, one of them is poor parental guidance. So if there's poor parenting in general, this may lead to an increased risk of this condition. Also neglect and abuse as well. And their attachment style. So if they had a poor attachment with their caregiver, so negative, or they were dismissed by their caregiver, this can increase the risk of getting this condition as well. So what are the symptoms of avoidant personality disorder and how do we diagnose it? Well, we actually look at the DSM-5 criteria. So the following is adapted from DSM-5. So patients with avoidant personality disorder have feelings of inadequacy, a pervasive pattern of social inhibition, and are hypersensitive to a negative evaluation. And these are present in a variety of contexts, beginning by early adulthood, as indicated by 4 or more of the following. So I just want to pick apart this statement. So they feel inadequate. So we talked about they have feelings of inferiority. So they have this belief that they're inferior to others in their social situation. They also have a pattern of social inhibition. They are inhibited emotionally, and they are very hypersensitive to negative evaluation. So why this becomes a personality disorder is because this is more generalized. We see this in a variety of different contexts, as opposed to some other conditions where it might be more specific situations. And this condition begins by early adulthood, and we're going to see what these 4 or more of the following are. So the first point is that they have avoidance of activities related to an occupation that involve significant interpersonal contact due to fears of such issues as disapproval, criticism, or rejection. The second point is that they do not want to get involved with people unless they are sure of being liked. The third point is that they display restraint within intimate relationships because of the fear of being ridiculed or shamed. The fourth point is that they are preoccupied with being rejected or criticized in normal social situations. The fifth point is that they show inhibition in new interpersonal situations because of feelings of inadequacy. Sixth, they view self as socially inept, personally unappealing, and inferior to other people. And the seventh point is that they are unusually reluctant to take personal risks or engage in new activities because they may prove embarrassing. So what all these 7 points really boil down to is what we talked about before. They have this belief that they are inferior, they have a fear of rejection, and they ultimately lead to avoiding a variety of situations, and they also have emotional inhibition, or they inhibit themselves in social situations. And again, we need this first point, this first statement here, plus 4 or more of these 7. Now, trying to remember all those diagnostic criteria can be difficult, but there's actually a mnemonic to help us remember, and that one is actually known as cringes. So again, we need 4 or more of cringes. So cringes is one mnemonic. There may be others, but I've seen this one being used. So cringes. So what do these letters stand for? So C stands for criticism or rejection, preoccupies thoughts in social situations. R is there's restraint in relationships due to fear of being shamed. I is there's inhibited or there's inhibition in new relationships due to fear of inadequacy. N is that the patient needs to be sure of being liked before engaging in social situations. G is that the patient gets around occupational activities requiring interpersonal contact. And E stands for embarrassment, prevents new activity or taking risks. And S stands for self-viewed as unappealing or inferior. So we need 4 or more of these in order to make the diagnosis of avoidant personality disorder, along with that previous statement we talked about in the last slide. So these might help you remember those other 7 diagnostic criteria we talked about in the last slide. It may not, but this is one way you can try to remember. So again, if you were just to think of the first word, because there's still a lot of words here, there's a lot of sentences. So cringes, C for criticism. So criticism or rejection, they think about criticism, so you can think that way. R is restraint, so there's restraint in relationships. I is that there's inhibition in new relationships. N is that they need to be sure of being liked. G is that they get around occupational activities. E is that embarrassment prevents new activity or taking risks. And S is that they are self-viewed as unappealing or inferior. So these, again, aren't perfect, but this may be a way for you to remember. So how do we treat avoidant personality disorder? There's actually not much research as to effective treatments for this condition. It's likely that cognitive behavioral therapy, or CBT, is beneficial. So getting the patient to understand their thoughts, understand their negative beliefs about themselves, and recognizing can help them combat those thoughts and beliefs and those schemas. And likely that interpersonal therapy is also a possible treatment as well. So these are our options for treatment of avoidant personality disorder. And what is the prognosis of avoidant personality disorder? This condition is actually associated with other psychiatric disorders, including depression, anxiety, and substance abuse, because a lot of times these individuals can't make strong relationships with others because of that fear of being rejected or feeling that they're inferior. They have those elements that we talked about before, where they are inhibited in social situations and they avoid social situations in general. So it's very difficult for these patients to make friends and make or develop relationships. So they oftentimes have issues with depression, anxiety, and substance abuse. And these patients, because of those things we just talked about, are more likely to be unemployed, unmarried, or single, and they are more likely to be less educated. So all of these things contribute to the worsening quality of life for these patients. If you want to learn more about other psychiatric conditions, please check out my psychiatry playlist. And if you haven't already, please consider liking, subscribing, and clicking the notification bell to help support the channel and stay up to date on future lessons. Thank you so much for watching, and I hope to see you next time.